From the Mumbai studios of Republic TV, it's time for The Debate.
Debate at 9, presented by Greenply E0, powered by General Air Conditioners, Star Health Insurance and MPL.
Thank you for joining us on The Debate. I am Niranjan Narayan Swamy, filling in for Arnab Goswami, who will be back on the show this weekend. The third phase of the vaccination drive in the country amid the raging second wave of COVID-19 across states is most likely to hit a roadblock tomorrow. That's the 1st of May, when it is scheduled to begin for all adults above the age of 18. 16 states and union territories have decided to delay the COVID vaccination drive. There is a record number of registrations, but a delayed rollout, and that's also our debate tonight. That's debate number 1. India, get vaccinated. There's no choice. Wearing a mask, getting the vaccine, the only options that Indians have. And we are looking at the solutions to India's vaccine challenge at 9 p.m., hours before the rollout begins. And a debate number 2 at 10 p.m. We have Ridhamanand Bhardwaj joining us on the Supreme Court's strong message to the centre. And here are the headlines this Friday evening. Some states delaying the phase 3 of vaccine drive, citing shortage of vaccine doses. Private hospitals pitching in, confirming rollout of the inoculation drive across India. First consignment of Russian-made Sputnik V will land in India on Saturday. Indian Air Force, Indian Navy, the Army carrying out mammoth operations to augment the oxygen supplies from across the world. Supreme Court demanding a national policy on vaccines and essential drugs for effective battle against COVID-19. Former Attorney General and eminent jurist Soli Sorabji passes away at the age of 91. Well, as we speak, some private hospitals have started listing slots for vaccination for those aged above 18 years old. Now, we seem to be slowly clearing the roadblocks in the massive vaccine drive. It's going to be a long journey, but one that we will complete. But is there more that we can do? Is there more that India can do? Is there more that the states can do? Here's more on what states are doing, and then we have a special panel joining us on the debate tonight.
The countdown to the third phase of world's biggest vaccination drive has begun. Amid raging wave of the COVID-19 infections across states, all Indians above the age of 18 would be eligible to get vaccinated starting Saturday morning.
So this is the CoWIN portal, like Mr. Sharma described. Now, when you come to the portal, right at the top, you have the option of checking your nearest vaccination center and slots availability. You have two options, either search by PIN or search by district. You just punch in the PIN code there, or you search by district, and he just mentioned one PIN code where he is right now, and that's the Gautam Budh Nagar, that's the district. And here it shows for 3rd of May, it shows the slots available for different dates. So for the 3rd of May, you have 90 slots available here at this center. But it also shows you the minimum age limit. So it may not be for everyone. This is for 45 plus. But as and when it becomes available for those between the age of 18 and 45, it will start showing up.
But the mammoth vaccination drive, planning to cover 84 crore Indians, has hit some roadblocks. Many states have already predicted a delay in starting vaccination of all adults, citing sporadic vaccine supply.
अभी तक वैक्सीन हमारे पास पहुंची नहीं है। हम लगातार कंपनी के टच में हैं। हमें उम्मीद है कि कल या परसों तक वैक्सीन आ जाएगी।
आम्ही पत्र लिहिले होते सिरम इन्स्टिट्यूटला की आपण किती देणार। त्यांनी सांगितलं की साधारणपणे आम्ही 13, 14, 15 लाख मे महिन्यामध्ये देऊ। कोवॅक्सिन असं म्हणतं की आम्ही 4-1 लाख मे महिन्यामध्ये देऊ, 4-4.5 लाख दोघांचं मिळून बेरीज जर केली तर 18 लाखापर्यंत बेरीज होऊ शकते। तर आता जरी लगेच उपलब्ध कमी असले तरी अपेक्षा करू की मे महिन्यामध्ये हळूहळू का होत नाही मिळेल।
What India needs at this hour is an aggressive vaccine drive, just like other nations have adopted.
62% of the population who have been vaccinated, the 80% number includes those who are recovering from COVID-19, and they're considered immune. We're also giving a booster jab to those people as well. Over the age of 60, we have 90% of that population that's vaccinated.
But there's still a silver lining. Private sector is pitching in.
Apollo Hospitals launching the vaccinations for those between the age group of 18 to 44. They will launch their vaccination drive as part of the third phase of the COVID-19 vaccinations. There is a press release that has just been issued by the Apollo Hospitals group announcing that they would begin the vaccination process for individuals between the age of 18 and 44 from tomorrow, that's the 1st of May.
The first batch of Sputnik V will arrive in India on Saturday. And vaccine manufacturers are easing the price of the doses given to the centre. With all efforts in the direction to ramp up vaccinations, a solution-based roadmap is the need of the hour. Let's debate.
And joining us on the debate this evening, Syed Zafar Islam, National Spokesperson and Parliamentarian in the Rajya Sabha, belongs to the BJP. Padma Shri Dr. Arvinder Singh Soin, Chairman of the Institute of Liver Transplantation and Regenerative Medicine in Vedanta. Dr. Alok Roy, who's the Chairman of Medica Group of Hospitals, joining us live from Kolkata this evening. Dr. Tanmay Mahapatra, who's an epidemiologist, live from Patna. Rajiv Krishna is an advisor and spokesperson of the government of Andhra Pradesh. But I'd like to begin this evening with Ms. Shobhana Kamineni, who's the Executive Vice Chairperson of Apollo Hospitals Enterprise Limited and a member of his founding family. Ms. Kamineni, thank you for joining us here on Republic TV this evening. We broke the news this evening of Apollo Hospitals, which will be among the first Indian private hospitals to begin the COVID immunization program in the third phase. Tell our viewers a little bit more about the back-end work that's undertaken to make this happen.
I think that the vaccine makers probably think we're the most annoying group. We've been after them for the last 8 months, saying that the day that the private, you're allowed, you have to be able to give it to us. And we showed our intent. Today we're the largest private vaccinator. We've done 500,000 vaccines so far. Of course, it's just a drop in the ocean. We claim, that that's nothing for what India needs and what India has done. But I do want to say that our heart is in it, and we're there. We have the first lot stocked and ready. And of course, people, much as we'd like anyone to be able to walk in, that's not reality. You need to register. The first lot for above 18 is you have to register on CoWIN, and we have to work with the state government and open up state by state. So I don't think it will be as fast and furious as we require, but hopefully it will be smooth and it will keep ramping up.
Yeah. Ms. Kamineni, the Apollo press release today says that as per the government guidelines, the vaccines will be administered to eligible individuals who have registered on the CoWIN app, which you just mentioned, and have made an appointment for the vaccine jab at Apollo Hospitals. Can you tell our viewers through how this will work? Because, we've been receiving so many questions from people. They've been able to register. They haven't been able to get an appointment. But with this press release, there is some hope that maybe in the next few days they can look forward to vaccination at a private hospital.
Absolutely, and what I can tell you is that our tech guys are going to be working all weekend to make sure that it's smooth. We have some experience in being able to do it for the plus 45. And near the end, it kind of worked out much better. We believe that we can make this happen much faster. And, there's some centers of ours, hospitals that even did 2,000 in a day. So I think we can probably get up to that figure quite easily and go even further. Yeah. But just give it this weekend. It's going to be a very busy weekend. Just want to tell everyone that the stocks are there. Yeah. And the next thing is that I might be a little out of this turn in saying this. But one of the things that Apollo took a call on is that there is a lot of confusion about people that require the second jab. And what we said is that let us make available. People are going to pay for this, and you need it, and there's confusion, and you don't want to wait. We will be able to give you that also. We'll reserve a certain portion of the stock we have to be able to make sure that those that require it don't run out of that exact time period.
Yeah, if I heard you correctly there...
And by the way, we have both.
Sorry, go ahead. Complete your point.
But by the way, we have both. We have Covaxin and Covishield with us. And hopefully now that you've said Sputnik is coming in this weekend, I hope we'll have that also available.
Well,
because we've set up our cold chain for the -20.
Well, I can tell you certainly all chief ministers will be envious of what the Apollo hospitals has been able to achieve. I'll tell you why. I'll tell you why. Because if I heard you correctly, you said it's taken. You've been behind them for 8 months. You said you've been behind them for 8 months. I'm sure it was a challenging task. Now, as an expert and someone close to the industry, do you think more private sector hospitals will be on board soon? Is it workable for them as well?
Yeah, 100%. I mean, everyone's been doing it. I see some of my colleagues here, of course, Alok and all, I'm sure that everyone will, Max has already got, so we will all be in this together. And I think that's the important thing, that this is collective. This is something that the government, we've been asking them to open it up, and now that they have, why would everyone not participate? And even our clinics will be giving the jab. We have to make it easy. I really wish that we would pick up some lessons from the West and have these mass vaccination places. I'm still hopeful that we can set those up in the private sector.
A couple of questions more, Ms. Kamineni.
Let me do 500 jabs a day.
Okay. Now that's the question I was coming to. We've with Apollo rolling out this vaccination program in private hospitals at a time when there is this debate about the prices of the vaccine. Now, many people are asking how affordable will this vaccination be at Apollo? Is it the fixed price that both these vaccine makers have announced?
So, you know what they've announced. It's all over the paper. So, 1,200 rupees is what Covaxin has announced. Very transparently, I'll tell you that they came to us and said, we'll give it to you for 1,000. Will you take the cost of administration within the 1,200 price? And we readily agreed. We said, that's fine, we'll do that. So anyone wanting a Covaxin jab, it will cost you 1,200. And there's a 50 rupee element of GST, which we couldn't absorb. Same with, we went to Serum, and Serum said, this is 600 rupees, and we're anyway half the price of Covaxin. So we said, okay, 600. I think that was not the time to be negotiating. And we said we'll charge the same standard 200 rupees plus the taxes. So we want to be super transparent and make sure that everyone in India understands that this is a time when we just have to make sure the cost of prevention is way cheaper and less stressful on healthcare than having to treat people who are sick.
Absolutely. One last question.
So it is affordable.
Yeah, it is affordable.
From that point of view, it is affordable. Yeah. It's cheaper than a test.
Yeah, I was coming to that question. That was going to be my last question. As someone who interacts closely with the industry, where do you stand on this demand of a few people who say that you need to have a one vaccine price across India? Is it feasible?
Yeah, I think that if the government steps in and spends a lot of money, But I can tell you there were so many people that came into Apollo for that 250 rupee jab, and they were surprised. They said, when we can afford it, and this is going to protect us, we don't mind paying for this. So as long as, we can get supply, for me, I think the critical issue today to be debated is how soon can we get 500 million people vaccinated? That is the one and only thing. Remove all other impediments.
Yeah. Shobana,
CSR of companies can subsidize it. We can find other methods. But let's just get it out there.
Okay, one short question. I remember reading out that press release which also mentioned that you've also signed up for several corporates. You will be helping them in vaccinating their employees. How many companies roughly will you be helping out with?
If we get access to it, there are at least 400, 500 companies that we're actively engaged with. And these are large that talk about, please vaccinate all the frontline, the people who deliver things to you, the people who are driving your cabs. These are the people who are actually making important things for India to keep the economy going. So I think it's an important role to be able to vaccinate them to make sure this economy keeps ticking.
Thank you for speaking to Republic TV this evening, Shobana Kamineni.
Thank you.
Thank you.
Appreciate
Thank you very much.
Thank you.
Thank you. Okay. Let me start with Dr. Arvinder Singh Soin. Dr. Soin, good evening. Over 85,000 new COVID cases in the last 24 hours. That's 3.86 lakh new cases in the last 24 hours. Isn't it clear that, as we are a few hours away from the phase 3 of the vaccination drive, it's not just welcome, but it's highly necessary and it's in all possibility the only option we have in front of us?
Absolutely. So, nothing is going to be accomplished by creating a lot of panic. So let's look at the silver lining. Let's look at the good news first. The good news is that vaccination has been opened out for all adults, but the priority is still being given to people over 45 years of age and those with comorbidities. There are several government and private hospitals that start with the vaccination drive for all adults tomorrow, I believe in 6 or 7 states.
Yes.
And the rest will follow in the next 3 to 5 days. The other good news is, of course, that Sputnik vaccine arrives tomorrow.
That's correct. And
apparently there'll be 50 to 100 million of those doses available in May. So these are all the bright things to cheer about. But there are problems. There has been no clear communication on the exact stock situation of vaccines in the country, who, in terms of the institutions, private or public, and states, who will get which vaccines, how many of them, and by when. Because we are a country that needs to be in a great rush, in a great hurry to vaccinate our people. Otherwise, we may not even see the peaking of the second wave for a month or two. Or even if we do, and the second wave is negotiated, there'll be a third and a fourth wave, unless we can get 80 or 90 crore people vaccinated in the next 4 to 6 months on war footing. So we need a lot of vaccines, and the government better forge all the deals necessary with the foreign vaccine makers, the people who supply the raw materials, and our indigenous capacity needs to be ramped up and used to the maximum. I mean, we are, after all, manufacturing 60% of the world's vaccines before COVID came, and we need to use that capacity to the fullest.
Yeah. When we heard the news this evening, Dr. Roy, when we heard the news that the first lot would be landing tomorrow, because we had heard from Dr. Reddy's that they were expecting the first lot to land in India maybe towards the end of May. You know what we did? We checked with our partners in Moscow, with Russia Today, the RT team, and they confirmed to us that yes, indeed, the first lot would be taking off any minute now and would be landing in Delhi soon. Now, what that tells you is that there was a call between the Prime Minister and Vladimir Putin a few days back. We know that things are moving. Things are moving. A lot is not said, but we know what's happening in the background. So when there are 16 states, Dr. Alok Roy, 16 states and union territories that are delaying the COVID vaccination drive for all above 18, Isn't it more reason for all of us to mask up, stay in, stay calm till the vaccine plan stabilizes instead of losing hope, shunning all precautions, politicizing? Dr. Alok Roy.
The human resilience is far stronger than any pandemic. Whatever may be the reason, the only thing which will prevent us from getting the infection is vaccination.
Yeah.
I think we all must put our patients in place and mask up, brace ourselves, stay at home, sanitize, and look forward to getting vaccination as soon as possible. I would urge all the authorities that please supply vaccine to us or allow us to collect it from the suppliers so that we can vaccinate the country.
Yes. And I wanted to get in, Zafar, on this point of 16 states, right? Zafar, there is Delhi, there is Maharashtra, there is Andhra Pradesh, there is Jharkhand, there is Gujarat, there is Rajasthan, there is Punjab, there is Madhya Pradesh, there is Telangana, there is Uttar Pradesh, Karnataka, Tamil Nadu, Chhattisgarh, Jammu and Kashmir, Goa, Arunachal Pradesh, which have said that they may not be able to roll out the vaccine program tomorrow. Why don't you tell our viewers, as a member and a parliamentarian of the ruling party, when can they expect stocks?
Let me tell you very candidly. First of all, that this rolling out process is beginning tomorrow.
Yes.
It's not going to end tomorrow. All the people between the age of 18 to 44 is not going to be vaccinated on day one. It is a process which has begun, which is going to begin tomorrow. And the scheduling will be done based on the total production and vaccine which is available and being supplied to various states, and various states is able to source from the manufacturer, medicine manufacturer. And then we will be scheduling based on the availability, but it is a priority and it will be prioritized. The ramp up production will be ramped up. The sourcing is being done by the government of India. All the possible sources which potentially can supply vaccine is being explored. And all I can say and assure the people, even those states whose government have decided not to start vaccination from tomorrow, that it will be available. The process has begun. Some states is in a position who have been able to source from the manufacturer. They will begin the process tomorrow. The registration process is on. People should register themselves. Scheduling will be done, and all of them will be vaccinated, and it will be on a priority basis. So it is very unfair. Some of the states or some of the political parties politicizing this issue. Is not an issue to politicize. It is a process which everybody should support because it is being done for the people of this great nation, and everybody has to take vaccine. Everybody, adult has to take vaccine, and that is what the government has taken the initiative. Of course, everyone knows that it cannot be done overnight, but the process has to begin, and the supply will be ramped up, the production will be ramped up, everything will be sourced, and vaccination will complete, as some of the doctors were saying, at the earliest possible. When I'll just give you one example, I think it is for everyone to see. The first time we realized, or the WHO announced that there is a pandemic, coronavirus is a pandemic, and that day we had no facilities for testing. We had only one lab in the country. Today, see, in 1 year's time, we have ample lab. We have sufficient number of labs. The 28 crore people have been already tested. Likewise, when the first day of vaccination had started, in 99 days, we completed 15 crore, which is the fastest among all the nation, including US. And at that point in time, most of the people in the country were saying that Western world have been able to place order with all the manufacturers in the world, and they have amassed 61% or 71% of the total production. And it is very unlikely the government of India will be able to source it or will be able to make available for its citizens till 2024. But see the situation we have been able to do in 2021, and we are already 15 crore people we have been vaccinated. So the government is using all its resources to ensure that citizens' interests completely safeguarded, and that is what we are doing. But this is not the time to do politics. This is not the time to have negativity. The process has begun. Let's all support. It's a collective effort. It's an effort which all the states and government, central government, have to put together to ensure that India unitedly fight this menace of corona and ensure that we are able to defeat and every citizen's and their life is being safeguarded. And that is what our initiative, that is what the intention of our Honorable Prime Minister under his leadership will be able to achieve it, and not only by under his leadership, with the support of every single state and the government and the citizen by and large, and with the active support of doctors, corona warriors, the nurses. Without their support, we cannot achieve this.
Yeah, I agree with what you said about working together, but ask Rajiv Krishna, Zafar, did we as a country announce, the vaccine for all program, which was much required, without actually having a blueprint in place for how we would roll out in terms of a timeline or the supplies? The intent was there, but where were the gaps, Rajiv? Because even your government, if I'm not wrong, is one of the 16 states that are not, pursuing the 18 to 44 vaccination drive tomorrow.
So the basic point here is, as Honourable Member of Parliament was just outlining, we are in no way trying to make this political. So let's get that straight first. So this is not a political issue at all. The Honourable Prime Minister, the entire central government, all the state governments, everyone is working hand in hand, working very hard to kind of come to a productive solution. So in that sense, there is absolutely no politics here. Now, the one thing which we are experiencing, let me outline what we are experiencing, right? So we have set up on the ground vaccination infrastructure so that we can vaccinate about 6 to 7 lakh people per day, right? So whatever the vaccines we are getting for the 45 plus age group from the central government as the Andhra Pradesh's quota, we are doing whatever we are getting, we are vaccinating them, and, we are not able to vaccinate to the fullest of our vaccination capacity, but we are doing whatever the best we can. Now, in terms of the 18 to 45 age group, right, where the states are responsible for procuring the vaccines directly from the vaccine companies, we have written to both Serum and Bharat Biotech. We have, in fact, spoken to their senior management directly. And, the main issue, and we have very clearly conveyed to them that we are willing to make payments as and when. There's absolutely going to be no delay in payments. We're ready to make the payments. We are ready to procure 4 crore vaccines from both these companies. The main problem is the vaccine companies are unable to give a firm schedule to us for planning the vaccinations for the 18 to 44 group. And as other people have said, that could very well be because it's just starting off. So, let's give them the benefit of doubt. I'm not in any way implying that we should start panicking because on May 1st they are not able to give us a proper schedule. Let's give them the benefit of doubt and, let's wait it out for another week or 10 days to see how it pans out. So absolutely, I agree with the others on this panel who have said that. Also, but however, it would be good if the central government and the vaccine companies can give us some sort of schedule of delivery so that we can, there's 2 things. One, we can plan our vaccination drive. 2 is also it's important to mentally prepare our citizens, right? We shouldn't give them some hope. We can't give a 25-year-old kid some hope saying that he's going to get vaccinated in the next 20 days. And he keeps trying to go get vaccinated and he doesn't get the vaccine. So to avoid that kind of stuff, again, as I said, let's give everyone the benefit of doubt because it's just a startup and it's a very, very cumbersome logistical process. So we will give them the benefit of it, but it would be nice if they can give us a schedule. The second thing I would like to say is that we received official communication, in fact, from the central government, the Government of India, wherein they have indicated the number of vaccines we are allowed to purchase, for example, in the month of May from the 2 vaccine companies. So, then those numbers are also not very high, and hopefully they will also go up as time goes on. It's obviously it's a startup phase, and the vaccine companies have a manufacturing capability, I believe, of about 7 to 8 crore vaccines per month. So even they are ramping up their vaccine capability. So let's all hope for the best. We are here to work with everyone and try to make the best of the situation. But as of now, there is definitely some lack of information from the Government of India and from vaccine companies And also, so let's just wait it out and see how it plays.
Yeah, lack of information. In fact, I saw a few medical experts agreeing with you while you were speaking about, more clarity there. But I saw Zafar also raising his hand. Zafar, you want to respond to him?
See, as I said, that this is not the time to do politics. But I also want to tell you a few important things. That I want to assure that every state will definitely be able to source from the manufacturers and or the other source which will be made available when the negotiations are on by the government of India with the potential product producers. But let me tell you that there are states who have been have been able to work. Like for instance, I'm just giving example. You had somebody from some hospital group. And she was Apollo Hospital, and they have taken initiative. Likewise, some states have taken initiative because there are not only 16 states in the country. There are other states. They are able to roll out tomorrow. They are able to roll out because they have been able to source from the same medicine manufacturers. Then others are still negotiating with them. So I'm sure that it's a matter of time when everything will be. It will be rolled out tomorrow, but everything will get stabilized over a period of time, and it will happen very smoothly. You must understand it's a very gigantic project. It requires enormous amount of effort, not only by the government of India, but citizens, but all the stakeholders, states. And when you it's a state's health is a state's responsibility. But when you split several groups in terms of states taking onus on number of citizens, then it becomes much easier rather than giving it a political color, but easier for them to take care of X number of citizens for the purpose of vaccination. And I'm sure it's a matter of time when everything will get streamlined, it will get stabilized, and people of this this country will feel comfortable being vaccinated before the third wave even arrives in the country.
Now, yeah. And Dr. Mahapatra, now, just looking at the positives of Dr. Roy, you wanted to come in? Okay, so I just saw him raising. Yeah, okay, go ahead. Yes. Make your point.
See, every hospital in this country wants to vaccinate.
Yeah.
Our biggest problem is that we are not able to source it. Apollo, being a large institution, is fortunate and has probably stronger ties. Whereas what we would expect the government to help us in sourcing it from the manufacturers. If there is some way we can reach to them, if government can help us in reaching to them, we all have been vaccinating for the last 4 months. Suddenly it has stopped. And our sense is that suppliers are not being very fair in distribution of vaccines to the private stakeholders. That's where I would really like government to come forward and tie up. We are ready to pay, we are ready to vaccinate, but we're not able to build that bridge with the supplier. That's our biggest problem.
Let me ask Dr. Mahapatra, if you don't mind, can I ask him a short question, a short answer if you can give me, Zafar? How many doses are we getting of Sputnik V tomorrow?
Well, let the government make this announcement. It will be unfair if I jump the gun and make that kind of announcement.
The reason I asked that question. Yeah, okay, complete your point.
Example. So basically, all I can say that the Honorable Prime Minister himself, using all his resources to ensure that the process of vaccination is accelerated in a manner that everybody gets vaccinated in the shortest possible time. And he's reviewing, as the doctor was talking about, the supply chain is being reviewed, none other than the Prime Minister himself. So all those issues which has been raised here, it is the Honorable Prime Minister is taking cognizance of everything. And I'm sure that the resolution will be in place before even you can think of, because it is being driven by the Honorable Prime Minister, and he's extremely sincere and sensitive when it comes to citizen and the country. And I'm sure that you will have the solution earlier than you are even anticipating.
Yeah, the reason why I asked that question about the numbers is because yesterday we hit a very, very, very interesting statistic. You know, Dr. Mahapatra, just yesterday we learned that in one state, in Delhi, there was about 17% wastage of one particular vaccine, which was Covaxin, 17%. Okay. Now, nationally, we know there has been a huge wastage of the vaccines which have already been delivered, which have been rolled out. Now, if we have, as a country, given over 15 crore vaccines, and if 17 to 20% is a wastage, I'm just looking at the number. Now, if over 3 crore people, or 3 crore vaccine doses have been wasted, I want to ask you, because Dr. Mahapatra, we have 2.4 crore people who had officially registered on the CoWIN app until this morning, between the ages of 18 to 44. That number may have gone up to 3 crore. Now, as a country, we have actually wasted close to 3 crore, if not more, number of vaccine doses, and we could have easily, vaccinated the 3 crore who've registered on the CoWIN app so far. Isn't that mind-boggling? That's one. Yesterday we spoke to the Israel deputy envoy to India, and she told us not a single, you can't compare India and Israel, but I'm just saying not a single dose, not a single vaccine dose was wasted in Israel. I'm just saying, because while states complain, they will also have to introspect on how we've wasted so many vaccines.
Yeah, this is really mind-boggling, but I would like to point out a few things before we jump into these percentages and what could have been, should have been, or would have been. The point is, we are dealing in this pandemic in its second wave after almost 1.5 years passed, and still we could not actually got into a coordinated way where government, non-government, community, and civil societies work together to ensure that there is a community resistance and community hesitancy are taken care of. And there are different scenarios where we have seen that vaccine centers have become the source of infection also because of lack of proper coordination, lack of proper mass management, as well as the panic. So altogether, while we are dealing with this kind of information regarding wastage, that is definitely something which is actually criminal. We have to ensure that going forward, given the scenario, we don't waste a single vaccine. We actually need to plan the whole vaccine delivery system in a way, as Honorable Member of Parliament was mentioning, in a smooth process. Now, this smoothness is actually required to be a conjoint phenomenon, where the community will get their expectations fulfilled, as well as we have to ensure that our vaccinators in each vaccinating centers across the country, they will be also at risk of getting infected all the time. So to ensure that they are protected properly and vaccine centers are not becoming a source of infection. I have several examples where people got infected while being in the mass while waiting for vaccines in different places. It's very important that we coordinate these situations in a particular way and pay more attention to the positive points where we can do something better and ensure that this kind of wastage and all other things are actually worked at the back end. What was the reason for those wastage? Where something went wrong? How we can ensure those bottlenecks are taken care of properly so that going forward, demand and supply matching in a way so that we don't waste and we don't make people wet. And for everyone in this country, it's now a panic which is not only mind-boggling, it's actually a disastrous thing. And we have, Dr. Roy previously talked about resilience. So to ensure that the community resilience reach up to a certain level, media, all the political parties, all the doctors, and all the important team members of the whole civil society ecosystem need to ensure that we are conjointly sending a message to our community that please don't panic. Please don't panic. Something which is going on is unprecedented. Together, we all need to ensure that we are using our common sense. We are not making ourselves stacking things which we don't need, and we need not to panic for this vaccination process. Let us follow the process. If the whole system can actually send this message to the community properly, we will be able to take care of the panic as well as we will be able to take care of the community resistance and vaccine hesitance. Then the demand and supply will be much easier to handle from the governmental and non-governmental vaccinating organizations. The calculations will match, and we will find these 17% values leading up to 3 crores or something becoming close to negligible, if not the situation in Israel.
Yeah.
Thank you.
Yeah, you spoke about vaccine hesitancy.
Niranjan, can I just add one point here? Just to reiterate what the earlier gentleman, he had mentioned a very important point about infections in vaccination centers and the panic mode, right? And as I was telling earlier, if the central government and the vaccine companies together can give us a blueprint, and maybe again I would like to reiterate that maybe they will take a couple of weeks to do it, and which is totally fine. We will wait. But as long as we get a proper blueprint of the vaccine delivery schedule, then we can manage the vaccination process much better, much more systematically, so there's no crowding at vaccination centers, and also managing expectations so that there's no disappointment, so to speak, leading to panic.
Yeah, Rajiv, I wanted to speak on bringing Dr. Soin on the hesitancy. I'll tell you why. Even though I don't want to make it political, Dr. Soin, you've been on many debates on Republic TV, more discussions more than a debate. But one aspect that has stood out in the build-up to the Vaccine for All campaign is how there has been so much of disinformation, and I'll tell you why I'm asking you about the vaccine hesitancy. Now, I'll tell you an example. I have the CoWIN app open in front of me. It's live. I have it open here, right in front of me, right? There are some states, okay, when you look for example, if I go to Maharashtra, I'm just saying live, when I click on Maharashtra, and for example, I click a city like Mumbai, right, with a population of nearly 20 million, there is no vaccination center available for booking. Try this, when I click on Delhi, okay, I'm going to click on Delhi right now. When I click on, let's say, for example, South Delhi, when I search, there are so many centers that are available, slots are available. There are some states. Now, ironically, the government in Delhi is saying that we don't have vaccines. I don't want to get into the politics of it, but I'm saying that as far as vaccine hesitancy is concerned, it is real. And even though vaccines are still available in several cities, people are not really booking their slots or going for the vaccination.
So yes, vaccine hesitancy has been...
Yeah, after Dr. Soin, if you don't mind, Zafar.
So vaccine hesitancy has been very much a real phenomenon across the world, Niranjan, not just India.
Yeah.
But as the infection rates have surged, there is less and less place for hesitancy. The so-called anti-vaxxers have actually taken to vaccination in my own hospital, where there are about 6,500 people. Initially, about 2,000 of them didn't take vaccination. But over the subsequent 2 months, especially in the last 1.5 months, 99.98% people have actually vaccinated. So the vaccine hesitancy is obviously going down because everybody understands that vaccines prevent severe COVID disease and save lives. You may get mild infection after the vaccination, but certainly not severe disease and death. And that is a message that all of us healthcare workers have been trying to spread. And everybody must get that on board. There is no place for hesitancy anymore. But having said that, it's not just a phenomenon that happened in India. It happened everywhere in the world.
Yeah. Okay. Zafar wanted to comment. Yeah, Zafar?
Also, I just want to highlight, it is not out of context, but it's very relevant, that it is also responsibility of the state administration and the state government not to let the citizen panic. Because, for instance, another example I'll give you. What the Maharashtra government have informed the Honorable High Court that they have oxygen, they have the medicine, remdesivir medicine, and many other things which is required for treating a patient. It's all available, but yet in the media everywhere you'll find that it is missing, it is not there, it is in short, the government is looking for medicine, looking for oxygen, looking for X, looking for Y. But when it comes to informing the Honorable Court, they inform the correct picture that everything is available, including vaccine, and the stock is being replenished by the central government on a regular basis. But when it comes to media, and when they want to speak to people and media,
Zafar,
they just necessarily
Zafar,
create panic situation.
Can I disagree with you there? I'll tell you. Can I disagree with you as you know, we have our reporters on the ground, right? Let me tell you, there are several states. I don't think you should go down that path because there are several states also.
All of us.
No, there are several states.
I'm not criticizing it. I'm saying there may be some shortage somewhere. But when it should not be really make a situation, the state government which looks that is a situation where every citizen should panic.
Dr. Soin, I saw him disagree with you. I saw Dr. Soin disagree with you. You want to respond to him, Dr. Soin?
I'm only requesting that they should maintain a balance. That's all.
While I agree that panic does no one any good, we have to call a spade a spade. We are at the front line and we are dealing with real oxygen shortages. We cancelled all elective surgeries, all elective admissions in our hospital today because we were not sure when we were going to get our next tanker of oxygen. Come on. We have to face that. And we have to.
City, sir?
We have to.
Delhi. He's in Delhi, Medanta.
Can I please complete? So I'm saying that while I'm the first one to advocate calmness and not to spread panic, there is no point denying what exists today. So we have to have a clear plan of oxygen delivery, city-wise, hospital-wise, over the next 10 or 15 days, because we are basically living from day to day. And I don't just speak for myself, I speak for 95% of the hospitals in the Delhi NCR.
Yeah.
Well, I'm not, I'll just take 10 seconds. Well, I'm not discounting the fact what is being narrated by the doctor. I'm completely in sync with you that whatever needs to be delivered, they must be supplied to doctor and frontline workers like you, because you need them to treat a patient. And I'm with you. So is the government, so is the central government. But all I'm saying, if you have something, then you should not propagate that you don't have. I think one should, if the state administration maintain a balance. For instance, since we are talking about Delhi, every day you'll see the AAP members or the chief minister will say that our requirement is 700, 800, 900. But today in the Supreme Court, what did the discussion has taken place? The state administration has spoken in the media, but they have not made a request to the central government to put the additional supply of oxygen. So all I'm saying, I'm not criticizing any government, and I don't intend to, honestly. All I'm saying that we need to also maintain balance, because panic does no one any good, as you rightly pointed out.
Yeah, but Zafar, I'll tell you from our ground reporting experience, I can assure you, in Uttar Pradesh, in Karnataka, now it is a reality. Even though the governments may say something else in the media, the reality is also different. I think Dr. Mahapatra wanted to come in. I saw him raising his hand. That's why I said let's not get into the politics of it, because I think every party will then become questionable. Dr. Mahapatra, you wanted to add?
Yeah, whatever is the case, you just mentioned 3.86 lakhs of cases yesterday. And in a country like ours, the way the exponential growth is happening among the number of cases, and we never see these kind of messages percolating that please don't take this condition lightly at its earlier days. Please ensure that everyone, whenever somebody is having some fever, some flu-like symptoms, something, that person either try to get some kind of medical help or follow the initial days guideline. We are always actually debugging a situation when either people in panicking in our milder symptoms, or they are already have crossed the milder situation to moderate or severe. So without getting into this, which state is actually asking for what and etc., I think we need to ensure that we are actually arranging for a situation where if somebody requires oxygen, he gets it or she gets it. If someone requires a bed, he or she gets it. And there is an optimization process so that people are literate, people made literate, and people made to use their common sense with the use of the community members and others, that when exactly to change gears in the treatment, in the management, then only we can reach up to a situation when we will be having a better control on this pandemic. And we are talking about the vaccination process. Let us please have a system of vaccine delivery across the country in a way so that we don't get crowded, panicked people gathering in a vaccination center and waiting for vaccine, which will come for a 1 or 2 minutes process. But the full time the person is exposed to probably the viral virus infecting him.
You know, ask Dr. Alok Roy. Dr. Alok Roy is in Kolkata, and West Bengal has just imposed a series of restrictions today, just this evening. And ask him the situation about how the state of Bengal has suddenly seen a spurt. It is a very serious situation in Bengal as well, isn't it, Dr. Roy?
Yeah, true. We have a serious problem of infections, and most of the hospitals are full. We have to turn down at least 100 patients a day in our hospital alone. So the situation is very serious. And I want to respond to the previous two speakers that in this country where 60 to 80% of healthcare is in the hands of private provider, we are more than geared and ready to vaccinate. As for the order of vaccination is concerned, if the supply line is ensured to us, we would vaccinate the country along with the government. So that state government is doing, not doing, really doesn't matter.
Yeah.
If state government does it, it will be good. But with the private sector is capable enough, if you assure them vaccine, to vaccinate this country. And which you need desperately. As Dr. Soin said in the beginning, if you do not vaccinate, we will not control the infection, and we haven't seen the peak yet at 385,000 infections in a day. We haven't seen the peak yet, my friend. And people are dying in dozens. We get 10 to 12 patients brought dead every day because of COVID. Hundreds of people are roaming on the street looking for a bed in ambulances on cylinders. It's a bad situation, sir.
Yeah.
Well, can I just take 10 seconds, please?
Yeah, go ahead.
Well, I completely agree with you the situation which you have just narrated. You are the doctors. You people are treating the patient. You have the first-hand information. I'm not discounting any of the fact you had stated just now. All I'm saying that it's a collective effort because it's a pandemic. It's central government is, as I said in the beginning itself, that the Honorable Prime Minister, under his leadership, whatever resources the country has, is being utilized to its fullest to ensure that the citizens' interest is safeguarded completely. And of course, I'm not picking or choosing any particular state for its efficiency or inefficiency. All I'm saying, that is a collective effort, and it has to be a collective effort. And together we can all, along with the frontline worker and the doctors and all the stakeholders, be it private players, be it the government hospitals, everyone have to come together to ensure that this vaccination process gets completed at the earliest possible. Yeah. And I'm sure that the Honorable Prime Minister is very sensitive about it in terms of the delivery of vaccine. Yeah. And whatever best needs to be done will be done, and ensure that it gets done in a timely manner.
Yeah, I just want to end with some good news, Dr. Mahapatra. If I can just show those pictures, because one thing that we at Republic say is forces first, no compromise. The scale of efforts of our forces, I'm talking about the Indian Air Force, the Indian Navy, and we had the pictures that came in. I'll just play those pictures out while giving you some details of how many sorties the Indian Air Force has done. 147 sorties carrying oxygen from not just within India and abroad to cater to the requirement of oxygen in the country. Airlifted over 126 oxygen containers from Singapore, Bangkok, Dubai. And let me tell you, we had also this Operation Samudra Setu, which has been launched by the Navy. And we had 3 or 4 vessels of the Indian Navy bring in these cryogenic tanks from different parts of the world. Now, nobody saw this coming. But what we at Republic here are saying is that, yes, there are many mistakes. We have to learn from these mistakes. But we should all be positive. And like our hashtag says, those are the pictures of the Indian Navy vessels that were involved in the operation. India, get vaccinated. We said vaccine for all should be a reality. It is a reality now. We all have to be calm and patient. It's going to be a little challenging. But we all need to get vaccinated. That's our only option, our only hope. On that note, I'd like to thank Zafar Islam, Dr. Soin, Dr. Alok Roy, Dr. Mahapatra and Rajiv Krishna. Thank you for joining us on The Debate. And coming up next, Ridhimanand Bharadwaj will be joining us on the Stay Strong India campaign. And the Supreme Court had a strong message for the centre. What more can states do? That's coming up next. Stay tuned.